Good morning, everyone. Thank you for the opportunity to speak to you. Just a short 7-minute perspective of what we're doing in the far, far northwest. Everyone around here knows this equation. Being pharmacists and medical doctors, we thought of changing this, and we're looking at something totally different. So that's what we came up. So BD is making lots more sense than MC. What it's all about, let me explain to you. We've got the building blocks, the microbiology, the pharmacology, and the pharmacotherapeutics. So what we try to do is we've tried to build in a system where whenever we do something, we keep this in mind. So if you look at this slide, most probably this is all I need to show you. Whatever we do, we will go back to this slide from the first year till the fourth year. So we try to use everything in combination, keeping this in mind. If we look a little bit further, hopefully we'll have a few students that know something about antimicrobial stewardship. So here's the goals, the essentials of all the different categories. We look at antimicrobial stewardship and especially the disease management of this, identifying skills, and this is most probably the target at this point in time, making sure that our students has got the skills to actually implement what we've taught them in the pre-graduate years. We look also at interventions, and that would be part of our whole program, explain them to the effectiveness of antimicrobial stewardship and the measurements of outcomes. If we don't measure, we don't know what we're doing. And then one of the focus areas is the relationship between pharmacy and infection control. This is something that came out while we were doing these antibiotic stewardship programs. So this is the steps. The first step or first level will be your normal teaching and learning. Then we look at the acquiring of certain skills, and that would be the soft skills, but also skills on how to actually implement this whole system. We look at the implementing of AMS, and then at the end, intervention and also monitoring of this whole system. So in short, this is what we do. We start in the second year. Microbiology, biochemistry, it's now running at the same time, same semester, right? The same with pharmacotherapy and also pharmacology. So we, as the clinical department, do antibiotic stewardship and antibiotics the same time as pharmacology. And then in your fourth year, we talk about pharmacotherapy and the whole work integrated learning part of this. And then something nice and excited is what we call emergency medicine. Now, this could be a little misleading, but this is the idea with this is to go back and see colloids, crystalloids, whatever we use, how that impact on our normal pharmacology and our medicine. So, not going through too much detail, I just want to show you, for example, biochemistry. We've changed the whole setup of biochemistry. We were focusing on two things. Basic biochemistry, your normal proteins and enzymes, but then this is the exciting part, the laboratory and diagnostic medicine, teaching the students how to actually read these lab results, what to do with these lab results, and where do you go, as you go along in your second, third, and fourth year, how to actually use this in combination with your pharmacotherapy and pharmacology. Pharmacology, we all know. Another exciting part is specifically your pharmacokinetics for pharmacists. So this would be a joint venture between pharmacology and pharmacotherapy, making sure that we understand what the pharmacokinetics is all about. And as a pharmacist, this is most probably where we're going to have the biggest influence on the AMS program, looking at the pharmacokinetics, but from two total different, or maybe two different perspectives. So when we start looking at this module, when we're at module 6, that's when we start putting in the skills. Now, putting in the skills, we do it by workplace, and also work integrated learning. And then the simulation. We've got a small simulation laboratory where we simulate everything that's being done in a hospital. The reason, in my class, there's 234 students. Getting them to a pharmacy or a hospital on a regular basis is a challenge. So we're taking the hospital and we take it to the students. So we've got HAL and HAL Senior. It's two of our mannequins, which we can do all sorts of things. The moment they die in the ICU, we reboot and we go again. And the whole idea is getting the pharmacy students with the technology and what they are focusing to actually start doing these processes. Module 7 is infections control, which is a new thing we start looking at, and that's the basics, from washing your hands till how to measure this in a hospital setting. And then your clinical skills. I'm not going through the whole list. There's a whole list of this. What I want to get through is Module 9 is when you start implementing it. Now, this is a challenge. How do you implement AMS as a student? So what we do is we send them out and say, well, this is the focus area, accountability and drug expertise. So go out and measure what's going on. So that it brings me to the last part of this, and it's actually implementing this whole AMS. So as we go down, what we do is we teach them this, and give them the necessary skills to actually go and implement AMS wherever they work. It could be in a retail or in a hospital settings. Now the idea is each of these type of things is necessary to actually get the skills into what we're supposed to do. So by giving this, and we do this as part of our practical settings. So for example, our pharmacology and pharmacy, or clinical pharmacy, will do the lecturing, and then we will do at the same time the practice, as we do in chemistry and those type of things. So there's all sorts of funny things coming out there, but the whole idea is to start chatting about this and give them the necessary skills. Module 10 is obviously intervention. That's where we get to when you start working. We do actually go through and make sure that they understand. So in all of this, this is where we want to be. We want to exactly do these type of things. So the take-home message, antimicrobial use, we know it's a problem. We know pharmacists has got a vital role in this, and our whole antibiotic stewardship program is based on this. The commitment of hospital and multidisciplinary. We work closely with our nursing practitioners in our ICUs, and then the awareness of all the pitfalls. And that, in 7 minutes, is what we try to do in a whole 2.5 years. Thank you very much.